Hey everyone, Dr. Luke Peterson here, physical therapist with a knee replacement therapist. I wanted to hop on today to start the first video of what I hope will be many videos. So I'm trying to start this new thing and we're going to name it the Knee to Know Show. So obviously knee spelled Knee because we're the knee replacement therapists. So a little fun play on words there, but this is the Knee to Know Show. And for this video, what I want to do is just a brief introduction of what our plans are, or what my plans are with this show, and we'll talk about a couple of different things here. So what I want to do is basically have this show that is close to every day if I can, every day, 7 days a week. Hop on, chat with you all for maybe 10-15 minutes at the most, talking about a topic, something related to the knee replacement surgery, preparing for knee replacement surgery, the surgery itself, recovering from knee replacement surgery, life after knee replacement surgery, whatever it may be. I want to talk about all those topics. I want to jump on, if people bring up questions, I want to address those questions and just interact with all of you and help you with wherever you may be in your knee replacement journey, and just give you as much information and as much knowledge that I have to help you all out as best I can. And hopefully as we go along with this and it builds up over time, you'll really start to have a lot of videos that we can pull from. So if someone asks a question and I did a video of it in the past, I can say, hey, check out this video I did that answers your question hopefully pretty well for you. So that's the plan. Short 10-15 minute videos, maybe not even that long, talking about different topics related to your knee. If that's knee replacement, if it's things similar to knee replacement, maybe talking about arthroscopic surgery, talking of course about physical therapy, being physically active and exercising. We're talking about things like different treatments besides knee replacement surgery and different options you have in that regard, and pros and cons, and just any questions that come up, frequently asked questions or questions that are asked by people in the Facebook group, on YouTube, on Instagram, wherever that may be. Just hopping on, talking with you, talking about the questions and things that are going on, all right? So for this video, I just want to give a brief summary of kind of where we are with the knee replacement therapist. So as of making this video today, we're kind of right in the middle of the coronavirus pandemic, as you all know, and obviously a lot of big things have been going on, a lot of changes in the world, in healthcare, and everything in general. And so where we kind of stand right now with the knee replacement therapist is we're trying to do everything we can to help you out and help you through this unprecedented time. And some of the ways we're doing that is, one is we started to offer and have up and running our telehealth resources. So telehealth physical therapy, coaching, consultation, whatever it may be. We are able to set that up with you and meet with you and talk with you one-on-one and help you through your physical therapy or your preparation or your physical activity or exercise questions, whatever it may be. We can hop on with you and discuss that in a very effective, very safe, HIPAA compliant manner. So that's something that's really huge. If that's something you're interested in, check out our website, kneereplacementtherapist.com. If you go under the resources, there's a tab for telehealth physical therapy. You can also scroll down on the homepage and you'll see the link to fill out the brief inquiry form, and we'll be in touch with you as soon as we can, all right? Some other things is we're working hard on getting new video programs up. That's kind of our bread and butter, is the video programs. So we have a video program. We have the prehab, preparation before surgery, ebook with the videos for the exercises and the exercise plan to physically prepare yourself for surgery. We have the conservative treatment program. So if you're someone who your surgery might be postponed very long with everything going on, this is a way to still manage your knee arthritis, your knee pain, and what's going on effectively, at home with things you're doing at home by yourself. So that's our conservative treatment program, a really great program that we just came out with. We have our what else do we have? We have our home exercise program, which is our over 30 different exercises, all exercises that you can do as part of your home exercises, either for preparing for or recovering after surgery. This is emphasis on home exercises, so really requires little or no equipment to perform all of the exercises that we demonstrate and show in those videos. So be sure to check those out on our website. Otherwise, myself, so currently, besides doing the knee replacement therapist and some other things, I work full-time in a nursing home here in Pennsylvania, and our nursing home actually just about little less than 2 weeks ago, we had our first positive cases of the coronavirus, unfortunately, and so we're just all kind of doing our best, taking things day by day to get through everything there. It's unfortunately spread to a number of residents and a number of staff, but so far at least, fingers crossed and positive thoughts that the impact has not been as devastating as you see in a lot of places. So we're doing everything we can to protect our staff, to protect the residents, of course, number one, and hopefully as these residents recover, we're jumping in there with physical therapy to get them back on their feet, get them back to their prior levels of abilities and physical abilities. So, that's something we're going through the virus day by day as well. So that's going on. A lot of people are always asking about, what's the biggest impact, what's the biggest thing you see coming from this in terms of for individuals with knee replacement surgeries or physical therapy, things like that. The one big thing is a lot of you who had your knee replacement surgeries maybe scheduled or were pondering if you wanted to have knee replacement surgery, there is going to be a significant backlog. There's going to be a long waiting list for people getting in for knee replacement surgeries and elective surgeries all across the country and across the world probably. And so what this means for you from a perspective of, what actionable things can you do with that information, it's all about staying prepared and doing everything you possibly can to manage your symptoms by yourself. And we can, of course, talk about this more in some later videos, but physically preparing yourself, so getting an exercise routine, if that comes from us, if that comes from your physical therapist or your surgeon, getting a physical exercise routine, prehab we call it, that's going to be very beneficial for you having a good outcome when you do finally get knee replacement surgery. And in a lot of instances, in some instances, you may even be able to avoid or delay surgery in the first place. And that's a whole nother topic of discussion. The other thing is preparing in other aspects. So preparing mentally. So there's so many different things in this regard, mentally, psychologically, but one main thing is focus on the things that you can control, right? You can't control the fact that a pandemic came through and your surgery got delayed significantly. You can't control that you have really not much of a clue of when you're going to be able to get in for your surgery. All you can do is stay patient, do everything you can to manage your symptoms, and live and do everything by yourself and with your family and your support system, and just be patient and be ready. And when that time comes for your surgery, you still have a very good chance of having a great outcome with that surgery. And the other thing is preparing your environment. And you actually have a long time to do this now, possibly. And that's things like, looking through your house, what things might I need for my recovery from knee replacement surgery or any other kind of surgery? What things may I need? What exercise equipment can I get or can I order? What clothing, ice packs, anything of that nature? Or who can I reach out to maybe get those things. Maybe a walker or a cane to use initially on, or long-term for some people. Those are some things to think about. But in the end, you want to focus on what's in your control. There's going to be a delay, but there's a lot you can still do in the meantime. And the other big thing, of course, is with the coronavirus pandemic is you're going to see this trend toward, obviously right now, of course, a very big trend towards the telehealth, the virtual health, virtual physical therapy. And I'm hoping that through this experience as a profession, physical therapists are really able to fine-tune our skills and our abilities to really provide a valuable service. Of course you lose that hands-on ability. Of course you lose that, being able to touch and feel and assess with the hands. But at the end of the day, the main thing that's going to help you and help you heal and recover is the resiliency and the power of your own human body. And that can be accomplished and achieved through exercise, through movement, through eating healthy, all those important things. So at the end of the day, with telehealth, you lose out a little bit with the hands-on things, but I think you actually really gain and get a tremendous benefit by still learning the potentials of your body, how to exercise, how to self-empower yourself and develop self-efficacy, that this is something that you can manage and that you can handle even without that in-person interaction with a physical therapist or other healthcare professional. So I said I wanted to keep these short. We talked about a couple different topics today, but check out Be on the Watch. This is again going to hopefully do this almost every day that I possibly can. A brief 10-15 minute video sharing about questions, topics, whatever is floating through my mind related to knee replacement therapy. So thank you very much for watching, everyone. This has been episode 1 of the Need to Know show. I hope you tune in again tomorrow, and we'll talk about a different topic. All right, take care, everyone. Have a great rest of your day.